And we are live. It's Dr. J here in the house with Evan Brand. Today, we're going to be talking about the root causes of nausea. Again, because we are clinicians, this isn't going to be just a symptomatic type of cover up. We want to actually get to the root cause. And because we have so much experience with it, we're going to be sharing with y'all things that have worked with our own personal selves, as well as our thousands of patients. So, Evan, let's dive in. How you doing today, man?
Doing really well. Excited to dive into this topic that conventional medicine doesn't have much to offer. They may put you on like a Dramamine if you've got some kind of a nausea issue, but it doesn't go much further than that. Maybe a Zofran in the conventional medicine world. You know, I've had clients that have had gut issues and mood issues and major nausea. If it's been an extreme situation, they'll go into the ER and they'll say, "Oh my God, I have the worst nausea of my life." And what do? They put them on Zofran, a drug, which is an anti-nausea drug, and it works. It is effective, but then they send them home and they said, "Oh, you must have just had an anxiety attack, and for your gut symptoms, you need to go see a gastroenterologist because I don't know what's going on there." So then they go to the GI doc. The GI doc doesn't say much about nausea besides possibly giving a prescription or maybe an acid blocker or something else. So it's just not really, it's not pretty. And so many people out there suffering. But I'll just tell you my story and then we'll get into some of the clinical pearls too, which is that when I had H. pylori and parasite issues, man, my nausea was terrible. I was telling you before we press record here live, man, I tell you, not only did I lose weight, but I had no appetite, or my appetite would swing, or some days I'm really hungry and other days I couldn't eat anything. And it's just because I had this baseline nausea going on. And H. pylori can do it to you. So I don't know if this is in no particular order. So I don't know if that's the top number one cause, but I would say it's definitely in the top three clinically. H. pylori infection, which is a bacteria that damages your parietal cells and it reduces your stomach acid levels. Just that reduction of stomach acid alone can cause that nausea, but also your gut lining can get irritated. It can get inflamed from the bacteria, and that can further the nausea.
100%. And a lot of these anti-nausea medications, they kind of work on the histamine receptor, right? They're like an H1 blocker or H2 blocker or an H3 blocker. Is that correct?
That's right. Yeah.
Yeah. So a lot of those medications are going to have a anti kind of serotonin type of effect. So what does that mean, right? Anytime we have issues with histamine, almost always there's going to be some level of inflammation brewing, right? Anytime histamine becomes a problem, think of your inflammation bucket as being overwhelmed or overflowing. So now we have to really get to the root cause of why that is. So, palliative wise, you could do an antihistamine if it's an every now and then thing. But if it's a chronic thing, well, now the question is why? And that's where we're just trying to take the conversation and go deeper to the root cause versus just talk about the palliative symptom cover up. Plus, not to mention a lot of antihistamine medications, they have a lot of fatigue and cognitive issues as a side effect. So it's not really a good long-term solution for a lot of people anyway.
Yeah, it's just not sustainable either. Now, like my grandfather, I know when he would go on a plane, he would take like a Dramamine, which would help the plane nausea. But what was causing the bucket to be so full? So you alluded to histamine. I think it's a huge piece of the puzzle. Why does histamine become an issue, though? I would say SIBO, intestinal bacterial overgrowth with histamine producing bacteria. What other things would you say are putting in the histamine bucket? Are you talking like, high histamine foods that are putting in the bucket along with the microbes? Are you thinking those are the two big factors that are filling up the bucket, or what else?
So definitely just stress from all different areas. So being a functional medicine doctor, you have to be really good at being a stress detective. So what does that mean? That means we're looking at physical, chemical, and emotional stressors, and we're looking at those stressors and how they accumulate. So if I deal with someone and we, hey, what's going on in your life right now? When did everything start? And I'm like, oh, there's a divorce going on. Oh, there's a significant move or an upheaval in the family. Okay, that's something we're going to make a note on, right? Now, a lot of times you can't fix some of that. You can just make sure they have support or, recommend a good counselor or just someone else to make sure that that issue is being supported and being processed in a healthy fashion. But we have to make sure now health is even higher when there's lots of stress. So when someone's stressed, we have to make sure diet is really good, amazingly anti-inflammatory, nutrient dense, kind of low toxin paleo template, really important. We have to make sure because of that nausea, do we have poor enzyme and acid secretion? So a lot of times that's part of the stress response is you have low enzyme and acid secretion. And so then when you eat foods, you feel more nauseous, you feel worse because of all that stress and inflammation and inhibition of enzymes and acids. So then we have to really make sure we can actually digest and break down our foods. People think that's a given. Oh, I'm eating a healthy paleo template, I'm going to have good digestion because my food's great. Well, maybe not. So we have to make sure the common sense things are in place. Are we chewing our food well? Are we hydrating with food? Right? Hydration with food may not be the best unless it's a couple ounces of water to get down pills. And then the third thing is, are we taking enough acids and enzymes and maybe even bile salts? Because we know not enough bile and not being able to break down fat can also be a nausea issue, right? Gallbladder issues are a big one. We see that with pregnant women, right? High levels of HCG and poor fat digestion can easily create a nausea environment there too.
Yeah, well said. And the infections too. So if you're trying to get to the root cause of the root cause, it's like, okay, low acid, low enzymes. Why? Well, the H. pylori could be one factor, parasites, various bacterial overgrowth. So you always have to address those infections. And maybe you're infection free, which would be pretty rare and awesome, but age alone can also do this. So after age 20, we've talked about him many times, but Dr. Wright's book, Why Stomach Acid is Good for You, age 30, age 40, age 50, age 60, enzymes and acids are going to go down every year, but of course, majorly every decade. And so by the time you're 60, 70, if you're not taking supplemental acids and enzymes, we're going to quantify this too, right? When you say we need to make sure you have adequate digestion, you're not just saying, hey, here's some enzymes. We're going to be looking at an organic acids. We're going to be looking at a stool panel. We're going to look at gut inflammation. We're going to look at steatocrit, which is a fecal fat marker. We're going to look at pancreatic elastase. We're going to look at the neurotransmitters. We're going to look at the amino acid metabolites. How are people digesting? So there's a ton of data behind this. We don't just say, you have bad digestion, here's a supplement. It's no, you have bad digestion. Let me show you on paper. Here's the infections, reducing the enzymes. That's the first domino. And then here's the inflammation from the malabsorbed food that's further affecting your gut barrier. And then 3, here's your amino acids. They're crap because you're not digesting your proteins. Now here's the protocol. So it's not just bad digestion, nausea, enzyme. There's more to it behind the scenes.
110%. I 100% agree. So we have to get to the underlying issue. Now, there are some natural things that can help, right? Lemon juice is a really nice one, right? Why does lemon juice help? Well, lemon juice has acid in there. So I think lemon juice primes the digestive tract to make more acid and to help better break down the food. Number 2, ginger. Now, I have ginger part of my ginger tea kind of recipe protocol. My patients know this is something that I recommend across the board. So when we doing a lot of killing or we have a lot of stomach upset, ginger, number 1, can calm down the gut. So if the gut's inflamed, it can calm that down, which can help better digestion, help move along motility and calm down the inflammation. Ginger also has a natural anti-nausea side benefit. Safe to take if you're a pregnant woman too, by the way, but it really helps with nausea from a natural perspective. So we love that because it's going to really help calm down the inflammation, which is part of the root cause, but also help with the nausea. So we don't have to be on a Dramamine or a Zofran or some kind of an H1, H2, or even H3 anti-nausea medication, which may only have side effects. So those are a couple of natural things. We can dive in and go deeper as well. Peppermint's also a great one. Chamomile is a great one. Guess what? Peppermint, chamomile, ginger, guess what? They're natural digestive bitters. So part of how they work is they're going to help your digestive system work better in regards to secreting enzymes and acids, which is very powerful. And a lot of those oils have anti-inflammatory benefits. So reducing inflammation and increasing digestive secretions is part of a good palliative solution. We can talk deeper because you kind of alluded to SIBO and maybe in the past when you had H. pylori that caused nausea. So if we're just doing HCl enzymes and ginger and not getting to the root cause, it's still a palliative fix, but better than a medication because it doesn't have all the side effects.
True. And I think it was probably the giardia too, right? We know that giardia can be an issue with the gallbladder. If you just look up giardia gallbladder, there's a huge connection there. And that was probably part of my fat digestion issues as well. So even after I cleared out the H. pylori, there were some parasites that I was still dealing with. So that could have been part of my nausea as well. You and I were talking about a guy earlier, a client of mine in his early 20s who has had constant nausea. He described it as 24/7 nausea for several years. Conventional doctors gave up on him. He sought out my help. I told him, and this is what we do as practitioners sometimes. We'll say, hey, look, I don't know the exact number one end all be all puzzle piece to this issue, but I'm going to run you through looking into these body systems. We found some infections. We found a lot of mold. And I'm like, hey, look,
Yep.
fingers crossed, this is going to work. We made a really good protocol. And now 6 months later, he's 99% better and there's no more nausea. So much that when we do a follow-up call now, I'm like, hey, do you have any complaints or concerns? Nope. And I'm like, oh, well, did you forget when you first came to me, you had nausea 24/7? Oh yeah, I remember, it's gone. I'm like, yay. Because sometimes going in, you and I were talking about the importance of foundation. So let's hit that real quick because people don't get to enjoy our pre-recording chat. But what we were
So
talking
I
about,
wanted to just to time in. I wanted to just
yeah,
define nausea. Someone in the live video kind of said, "What's nausea?" Well, nausea is that queasy kind of upset feeling in your stomach. It's kind of, you may get a little bit dizzy. It's that in between of puking and vomiting, but you kind of just feel like your tummy's upset. You feel queasy. You feel a little bit dizzy. You feel about ready to puke, but not
yeah,
quite there.
I'm sure everyone's experienced nausea at one point.
Yeah, I think everyone has for sure.
Yeah, but so with this guy, which can happen with nausea. And it did happen with nausea. I didn't know on paper, looking at the labs, we saw some issues, but I didn't have a number one smoking gun that I was convinced was the root cause of his nausea. But we went through the foundations, getting the diet in order, addressing the infections, using binders to pull out mold and other toxins. And hey, look, he got better. It's amazing. So there are certain cases where we may have symptoms that sound weird, or maybe we don't have the end all be all smoking gun right in front of us, but we're going to run you through the system, address these body systems. And there's so many things that just happen. Have you seen that where you kind of say that the symptom improvement is a side effect of getting healthy? It's like, hey,
Yeah.
we made you healthy and your issue went away.
Yeah, the problem with conventional medicine is they give you a drug that may help with that side effect or help with that issue, but then the side effect may be worse. Where we're going after something totally different, right? An H. pylori infection or not enough stomach acid from SIBO, and then the side benefit is the nausea goes away. So that's what happens when you go upstream and you deal with system issues. Symptoms downstream manifest. When you treat symptoms by themselves downstream with medications, then you have more symptoms that happen from the medication called side effects. And so that's the difference between when you get to root cause stuff versus symptom care.
Yeah. Yeah. And the peppermint, man, I'm glad you brought up peppermint. I drank my body weight in peppermint when I had H. pylori. My gut was just raw. I was doing some DGL. I was doing glutamine. I was doing other gut healing nutrients, which we can talk about now. I think that could be part of the palliative care with nausea. You mentioned chamomile already, but the glutamine, the aloe, some of like the gut soothing nutrients. We did a whole podcast on that. Go check it out. Early July, top 7 nutrients to heal your gut. A lot of that stuff could actually help with nausea too. So there may be some overlap, but it's always working backwards. So number one thing, get your stool looked at. Number 2 thing, get your urine looked at. Number 3, I'd say get your environment looked at. This young guy, he had tons of mold in his bedroom. So we actually had him start burning some of the candles that we have, some mold candles, and then doing the mister in his bedroom. And we retested his plates in his Petri dish that previously looked very moldy, indicating he had a lot of colonies growing in his room. We retested the Petri dish and it looked much better. So for him, I do believe there was an environmental component as well. So when you're working with a practitioner, hopefully they're addressing all these root cause body issues, but in some cases it could be an environmental issue. I had a lady who lived with her mother, and her mother was always burning candles, and somehow the candle was making her nauseous. So she swapped out the candle for an essential oil one, got rid of the synthetic fragrance, and the nausea went away. So some people are going to have nausea from smells, whether it's car exhaust or cigarette smoke or perfume or deodorant. The chemically sensitive people out there, nausea can come from those chemical sensitivities. So if you're not already addressing your body care, your skin care, any hair products, soaps, shampoos, laundry detergent, dryer sheets, going free and clear, go unscented or essential oil based with all those products, that could also improve nausea.
Yes, 110%, 110%, man. I think we're right on the right track. Always trying to get to the root cause. Someone wrote in, would you suggest giving lemon or ginger if someone's on a histamine diet? I think it's worth it. If anything that can help stimulate digestive support is great. Typically, I'm going to come in there with enzymes and acids off the get-go because that really helps of course, right there. If you want something more at home, you can do the ginger and apple cider vinegar or lemon juice. That's fine. If not, we're going to use our own digestive supports. I think that's a really, really good first start, because if you improve digestion, that makes a big difference. Now, testing, we're going to do some deeper stool testing to get to the root cause of what's happening and see if there's an H. pylori infection, if there's a SIBO infection. We're going to run some organic acids. We're going to look at gut bacteria and yeast in the urine. So we're always trying to get to the root cause, but then we have these palliative things that are up our sleeve with the ginger and the B6 and peppermint and our gentle kind of chamomile and Swedish bitters.
Yeah, I love the gut healing herbs. You can use them if you don't know what's going on, but hopefully just by clearing infections, nausea is going to get much, much better.
Excellent. That's really good, man. We're on the right track here. Anything else you wanted to highlight here from a root cause perspective in regards to nausea?
Well, I've had many, many clients get their gallbladder removed, and
Yes.
now they're just in really bad shape. They've got constant nausea. And these are people that, and this is not to make me sound good, this is just a reality. But if they would have come to me before they got the gallbladder out, hopefully we could have saved their gallbladder by removing infections, increasing bile salts, things like that, to save the gallbladder before it became to a crisis level where they had an emergency gallbladder removal. But it's a huge, huge problem when the gallbladder is removed, because you're still going to be producing bile. You're just not going to be able to store it and concentrate it. And
Yep.
People that are going on paleo or keto or high fat diets, they're like, well, why am I so friggin' nauseous now? I thought paleo was the answer, or autoimmune paleo. Why am I so nauseous? Well, if you don't have a gallbladder, you're disadvantaged. So you're going to need a little more help than the average person with the digestive piece.
Yeah, I 100% agree. I got sick last year up in Boston in the North End. I was at an Italian restaurant. I ordered a steak, and I really felt nauseous. And I think I got food poisoning or a gut infection. And it was a Friday night, and I was just nauseous until I got back home Monday morning. And when I got back, the first thing I did was I hit my GI Clear 4, and within 30 minutes, the nausea was gone.
What's in there?
The GI Clear 4 had a lot of berberines, a lot of golden seal, and a lot of burdock. Burdock's excellent for the lymph. But as soon as it hit my tummy, I felt 1,000 times better. And so there was probably some kind of a food poisoning or some kind of a microbe in the gut that was really triggering a lot of that nausea-like receptor site activation, whether it was a histamine or an inflammation issue. It was really driving that. But my GI Clear 4 made a huge difference. I was doing a lot of ginger and apple cider vinegar drinks. So that's what I had access to at Whole Foods. That helped a little bit, but you could feel it. It was just palliative. It wasn't getting to the root cause. As soon as I did my GI Clear 4, it was like gone. It was like, whoa. It was like someone just flipped the switch and turned it off. I couldn't believe it.
That makes sense. Well, I guess one thing we didn't define yet is the difference between acute nausea, which I would consider your situation there more acute nausea, versus what the guy I was talking about. That was a more chronic nausea.
Chronic issue.
This guy had been nauseous for years. You were nauseous for days. So in that aspect, there would be a little bit of difference for you. You didn't need any testing. You didn't do a stool test and wait for the results. You got home, you took some herbs, you felt better. So that's good. So I guess, so far we've been talking more chronic, but regarding the acute, another thing I would throw into the mix would be some type of a binder, whether it's like a fulvic acid, charcoal, zeolite clay, bentonite clay. Those type of things could be a game changer. And I always have a bag of that in the diaper bag. So my wife and I are out somewhere. Let's say I got food poisoning. Maybe it helps, but it's definitely not going to hurt to pop a capsule or two of charcoal.
It can. And don't get me wrong. In this situation, I had charcoal, I had oil of oregano, I had probiotics. None of that touched it. When I hit my GI Clear 4, within 30 minutes, I couldn't believe it. It was like I was in this fog, and then it was just totally lifted.
That makes sense. So the charcoal wouldn't work if it was like a bacteria histamine issue, right?
Yeah. If it was a food poisoning kind of bacteria issue, it probably wasn't enough, because it's like, you send in 10 police to arrest 100 people. Think of the charcoal was the policeman, right? Well, it's not enough, but if you kind of drop a bomb, so to speak, with the herbs in the tummy, all these unruly bacteria, you're just going to knock everything down. I think we just needed bigger guns, right? The gut, the microbes, there was just a lot of unfriendly microbes out of balance there. And once I dropped the GI Clear 4, it moved the needle. Now, I did oil of oregano ahead of time. So I've just learned wherever I go, I bring that GI Clear 4, because the burdock root with the golden seal and the high dose berberines and the grapefruit and the black. There's just a good synergy of herbs there that have really helped me a couple of different times in Mexico with parasites and with this nausea episode. It's been absolute game changer.
I love to hear that. I've used a lot less oregano in the past couple years clinically because of the synergistic herb formulas that you and I have. I just find they work so much better than just oregano. Like if I used to see like a candida or maybe a parasite, I may throw some oregano in on top of it. But I don't know about you, but I'm using a lot less oregano in isolation now. I'm much, much more happy with our complexes.
Yeah, I mean, I kind of do a combination of the two, especially if there's candida. But yeah, I totally agree. Some of the combo stuff is really, really nice and helps with the root issues. So recap, what are some of the big things we have to look for? We have to kind of draw a line between an acute episode of nausea and a chronic episode. If there's an acute episode, we always want to think food poisoning or infection. Okay. If there's a chronic episode, well, we want to think potential infection, right? But we also want to think stressed out nervous system, sympathetic overload, not enough enzymes, not enough acid, not enough bile output, right? Not enough bile. We're going to have a hard time breaking down fat. Liver and gallbladder and poor fat digestion issues are known to cause nausea. So adding in good, whether it's just bile support or whether it's phosphatidylcholine or some taurine or some dandelion root or some fringe tree extract are all very good for the gallbladder. Also just the enzyme, the lipase and the bile salts can be helpful. Good proteolytic enzymes, good hydrochloric acid. All of those can be incredibly helpful at supporting good digestion. And then which is a side benefit, the nausea goes away. See, with a lot of natural stuff, we don't really have side effects. We have side benefits. If you're really sensitive and you're inflamed, there's always can be a little bit of an issue because your tummy may or your body may just be so inflamed. But if you're relatively healthy and stable, most of the time you get side benefits with natural compounds, not side effects.
Right. So if you're using the antimicrobial herbs, you're knocking down the pathogens, which is the main mechanism. But then number two, the nausea went away. So that's awesome. I love how that works. And regarding the testing, like I said, in your case, it was acute. You didn't need testing, but in chronic cases, yeah, we're going to be looking at stool. We're going to be looking at urine, possibly environmental. Like I told you, for this young guy, he did have mold in his bedroom. The levels were quite high. Mold can cause nausea. It can cause dizziness. So some people have that combo where it's a little bit of nausea, vertigo, dizziness combo. It could be related to that. And then I would say stress and trauma too. I mean, I had a woman who had a really, really bad interaction with her boss. And every day on the drive to work, she would get nauseous. And I thought, okay, what's in her car? She had a Mercedes-Benz did a recall on 2.5 million cars for mold growing in the HVAC system. So I thought, is this lady getting exposed to mold? Nope. We did Petri dishes on her car. It wasn't moldy. She was fine. But why was she nauseous every day on the way to work? And I thought, well, I don't know. She thought she was EMF sensitive. So we had her disable all the Bluetooth functions and all that on the car. Nope, that didn't help. And then we talk about this boss, how she had this really, really bad interaction with the boss. And I'm like, okay, well, does the boss still work in that same office? Yes. And then the boss goes on vacation. Guess what? Her nausea magically goes away. The week that she's driving to work where she knows the boss isn't there, she has no nausea. I go, oh my God. So there it is. It's some type of emotional trauma. And you have this like cortisol response, which cortisol could cause nausea from the stress. And so we just had her start doing tapping. We had her do emotional freedom technique, tap, tap, tap it out. And the trauma went away. And now she could drive to work without getting nauseous. So sometimes you have to probe. And sometimes you think it's going to be something simple. And it ends up being related to that. So don't forget about the emotional component. If you've got bad boss, bad spouse, let's say you're getting nauseous on the drive home and you're going to go in and you and your husband still have some stuff to resolve. It could be a normal reaction to be nauseous about that. So please don't forget about the emotional work. And emotional freedom technique is free. It's effective. Justin and I love it. We personally use it. We clinically use it. Tapping could be another strategy and sort of a Band-Aid that could be palliative and root cause with nausea. So I think it's a great, great tool.
Yeah. Also, if you look at this acupressure points too. So if here's your hand, it's called P6. So it's right about here. So it's about an inch or two down from the wrist. And if you massage this, P6 can also be helpful.
Yeah, they have
Just
bands.
massaging that.
Have you seen those? I tried them. I bought those nausea bands to try to go out on the boat. I mean, it was kind of limited success for me, but some people it works.
And again, this is kind of more palliative, but nice thing is, I mean, what kind of side effects do you have with this? And it's free, right? So you can rub here, this area,
Yeah.
or
So
you can rub
people
this
listening
area
on
here too.
audio, he's showing you right on the inside. It's in between the two tendons right there, right on the wrist, kind of maybe 3 inches south of your wrist, headed up towards your elbow, but on the inside of your arm. And then the other point he's showing is right on the back of the hand, sort of in that little crevice where the thumb and the pointer finger are going to meet. Right in that in between there, you're saying just hold it there, and that could help.
Yeah, you can just massage this area right here in the web between your thumb and your index finger, that little web, that little fleshy area. And again, this is on video here for y'all. So if you guys can see, you can rub this area here. This is a great area. Like when my wife was in labor, giving
Oh,
birth,
and it does help.
I'd massage this area here.
This is not like some placebo stuff. This really does help.
This helps. And then right about 2 inches. So you feel like the aponeurosis here, this kind of connective tissue right below it, right in that area, right in the middle, below the middle finger, all the way down, just below where the tibia and the ulna, I'm sorry, the radius and the ulna are connected, that little gap there.
Yeah.
And if you guys are listening, watch the YouTube video we'll put down below. I know it's hard to describe this stuff here, but we'll try to put in the notes maybe an image of that so you guys can see it. But that's very helpful. So if you're feeling nauseous, give that a rub. This is P6. This is another point right here. You can do that one. And then if there's a certain stressful event that's causing a problem, right? The boss or a stressful situation with a friend or family member, you can do all your EFT tapping points. I like the double tap.
Yeah.
So I collarbone, chin, you only got one chin, only one tap there, under the nose, under the eyes, tip of the eyebrows, medial eyebrows.
And you always talk about how you're
suture.
thinking about it too. Like you would be thinking, I'm stressed about this person, or are you doing the remedy? You're thinking I'm calm. Which are you mainly doing?
I always start with the problem because it's really hard if you're thinking about a problem to be like, stop thinking about the problem. You kind of need to calm the problem first, and then you can start thinking about what you want to manifest. So I'm just like, hey, that boss issue, like, man, this person's really driving me nuts, man. I'm feeling really anxious about this boss issue. Wow. Like, really stressed to go to work today. And I'm thinking about that. And then once I do a couple of rounds and that level's down, then I switch. Then it's like, all right, we're going to have a great day at work. We're going to have awesome communication. We're all going to be on the same page. We're going to have a really great meeting today. I'm going to communicate my needs clearly. I'm going to set my boundaries clearly. So then you can kind of talk about what you want to manifest afterwards. So I try to get the sensation level down below a 5 or so, scale of 1 to 10, 10 being the worst. Maybe you're at an 8, get it below a 5. And then you can start doing it while you focus on what you want to manifest. That's very helpful. I think that's really good. And then you can do the points too. You can also tap these points if you want. P5 or P6, you can tap these points too.
Yep, I love it. Also, the peppermint oil and some of those things, essential oils topically could be very beneficial too, whether you're just sniffing them, whether you're putting like an anti-nausea blend in a diffuser. I know when I had gut infections, I was doing a lot of peppermint essential oil mixed with coconut oil to dilute it, and I would rub that topically on the belly. It was a game changer. Game changer. There's been studies on that with IBS, and it's awesome. So orally, taking things in capsules, doing peppermint teas, also topical oils, the EFT, addressing the emotional stress, getting tested for the infections, clearing those out. There's a lot of good tips in this thing. So if you need to replay this podcast twice, do it and share it with people, because there's a lot of people suffering and they don't get the answers they need. I really hate when I look at a list of supplements or medications that our clients are on when they first come to us, and they're doing 2, 3, 4 things just to try to help get them out of bed. It's like an anti-anxiety, it's an antidepressant, it's an anti-nausea, it's an IBS drug. It's like, oh my gosh, we got to help this person.
100%. Now, a couple patients write in here about cleansing the liver. Well, if you have a lot of gallstones and your gallbladder is not functioning properly and you're not breaking down fat, that could definitely be part of it. I typically don't try to go flush out stones, because if you flush out a stone, think of a stone could be like a porcupine, and it's like giving a porcupine a hug when that gallbladder contracts. So I just try to gently emulsify the stone. In my line, we use the Liver Supreme because it has some herbs in there that help kind of emulsify it and gently kind of smooth it out. And also it has bile salts in there and phosphatidylcholine and taurine. So I try to use things that smooth out the stone versus flush it out, because you can potentially cause a gallbladder attack. And then extra bile to help break down the fat too. So then we're not having the poor digestion of fat causing nausea either.
Yes, yes, good points. Yeah, HCl enzymes, oxbile, the taurine. I do a lot of artichoke, beet powder, methionine. There's a lot of good things you can do.
Exactly. And then just to be clear, this point is Li4, Li4. Okay. And then this one here on the wrist is you take the wrist and you put 3 fingers across the wrist. Right. And then it's the pinky finger. It's that third finger down below. I'm sorry, the index finger.
Hmm.
Third finger down below
To
is that's
measure,
the
you're saying that's
that's
how
the
you measure it.
P6.
So,
Yeah,
so
that's how you
people,
measure it to find it.
yeah, so people listening, you'll put 3 fingers at the bottom of the hand, right where it connects to the wrist on the inside there. 1, 2, 3 fingers, long ways down. Boom, there it is, or
Yep.
horizontal.
And
Yeah.
that can help with pain and nausea. Yep. So that's the L6 and the P6, or I should say the they call it Li4. I'm pretty sure L4 is an abbreviation, and then PC6 or P6. Those are the big ones. So if you guys want to Google that, you can find some images and videos on how to do that.
Good. There could be some, last thing I'll mention here, there could be some issue with the ears. I've had some clients that have had issues with their sinuses and or their ears causing nausea. And so I'm not saying you need to do this, but I'm telling you what I've done before is I've done like some grapefruit seed extract in the nose or grapefruit seed extract in the ears to try to clear out inner ear type issues that could cause nausea. And it has been beneficial. Some people have reported silver being good up the nose and silver in the ears if there's some type of a viral issue. There are some viruses that can affect the inner ear, and that can cause some nausea as well. So I am not an ENT, so consult with your ENT and ask them about that. But ears, nose, throat, those kind of issues could possibly be related to this.
Yeah, usually with ear stuff, you're going to have a lot more vertigo, dizziness than nausea. So if usually your vertigo is the primary issue, followed by the nausea as a secondary issue. We're talking more nausea as the primary issue.
Yep.
But if that is a problem, you got to get to the root cause. So even with vertigo, a lot of times autoimmune stuff can be at play, thyroid stuff can be at play. If it's a otolith crystal issue, where there's different techniques that you can do. A lot of chiropractors will put you on your back. So imagine I'm lying on my back. They'll tilt your head back and they'll have you turn one way to kind of move the crystals through. A lot of times they'll do massage or a percussor on the back of the occiput area to kind of jiggle out those crystals, and they'll tilt it this way as well. So they'll go back and then tilt one way, hold for 30 seconds, back, tilt the other way, hold for 30 seconds. That can be helpful if it's a true otolith crystal issue, but it may not be for everyone. So there's a lot of different root causes. That's why coming up with one medication to treat it is silly, because there's so many different root causes. That's why the more you know, the better.
That's true. That's true. Well, I think that's all I wanted to cover. If you have anything else, let us know. But otherwise, let's wrap this thing up.
Yeah. So a couple patients write in the chat here. Well, can slippery elm or can fennel help with the tummy? Well, it just depends, right? So if there's inflammation in the tummy causing the nausea, anything anti-inflammatory for the tummy, like glutamine or ginger or slippery elm or DGL or aloe, could potentially help with the nausea. Like, let's say you had a food poisoning issue. Would that be enough to help with the nausea? Maybe not, because you'd probably need more antimicrobials in there as well. So you always have to connect it to the root cause. So if it really helps, some of those anti-inflammatory healing, soothing supports, aloe, bone broth, collagen, it's probably more of an inflammatory issue, probably less of an acute infection issue. So you just got to figure out the root cause. And that's why seeing a good functional medicine doc like myself or you, Evan, is going to be great. And if you guys want to go see Evan, evanbrand.com and justinhealth.com, we are available worldwide to help you if you want to dive in deeper and get to the root cause of what's happening.
Yep. Well, thank you for the plug. I'll mention it too, in case people like my voice better than yours. If you want to reach out to Justin, justinhealth.com. He's available worldwide. And me, evanbrand.com, available worldwide. We love helping people. We're truly blessed. We're truly grateful for the opportunity. You know, we've suffered and been on our own journeys, and we've recovered from significant things that many doctors just threw their hands up at, or maybe they threw the prescription pad up at us and we denied those things. And so we're really honored to be able to have this knowledge personally and clinically. And, you know, we learned so much from you guys. So, you know, please reach out if you need help, and we'd love to get to the bottom of this with you.
100%. We are here to serve. And if you guys enjoy this content, please let us know. Let us know what you like. Let us know what you've experienced in regards to helping improve your nausea. Again, everything that we're talking about is not just something theoretical you see in PubMed or you read on some blog post. These are theoretical things that we've done with hundreds of patients out of the thousands that we've seen. So it's all actionable. I hope you guys apply it and at least take away one thing that you can work on here. And you guys have a phenomenal day and continue to maintain optimal health. Take care, y'all. Bye
Take
now.
care. Bye-bye.